All right, so we're going to go over just some of the recent data points in regards to COVID. There's another report that came out from the Oakland County Health Department earlier today. Unfortunately, we didn't get a chance to slide it in. So this is the period from August 20th until September 2nd. And one of the new features in the weekly report from the Oakland County Health Department is going to be the different arrows. So green, meaning there's been a decrease, red, an increase, a blue arrow to the right, basically staying the same. So we're still seeing things as far as what we're looking at that are going to be in that yellow range for us. And so we know there's red, there's orange, there's yellow, and there's green. And so we're still going to be in that yellow area. 7-day Oakland County case average, this was pulled yesterday. We're looking at a daily rate of about 6.6% and a positive test rate at about 4.5%. And again, this was pulled yesterday, and we know each day as new information comes in, it changes a little bit as well. Kind of reminder from the last Board of Education meeting that there's now additional testing that's available. So there's drive-through COVID-19 testing services that are available. So kids 4 to 17 years old with symptoms who live in Oakland, who live in or attend school in Oakland County, now qualify for free testing. So some additional updates based on additional information from the Oakland County Health Division. And they've been really giving us a lot of information in the past couple of weeks, past 3 weeks, which has been fantastic. So we know that the Oakland County Health Division and the CDC does not currently recommend universal symptom screenings be conducted by schools. So on-site screening might be advised when cases have been identified in the school or in screening, or screening can be implemented while maintaining social distancing. Screening is going to be required before entering the bus or school buildings. Once an individual arrives at school and they are symptomatic, exposure to students and staff that are close contacts have already occurred. So this is kind of what we talked about last time. We really need the support of the community and those that are having their children return to face-to-face to make sure they get that pre-screening done. So some additional updates on the COVID-19 pre-screen, staff and administration screening. Daily screening is required using the staff and student screening checklist or virtual equivalent. And we've taken the exact information from the Oakland County Health Division and used that. It's also strongly recommended that daily temperature checks are included in the screening for all adults. As far as student screening at home, every parent, and this went out today, guardian must submit a COVID-19 school health screening acknowledgement form prior to the start of school year. Again, this is something that we received from the Oakland County Health Division. And parents, guardians must screen daily for symptoms at home prior to boarding the bus and arrival at school using the staff and student screening checklist. Before and after school activities, and this is kind of new. And this is based on the Oakland County Health Division information as well. So we need to conduct screenings prior to all of our after school and weekend activities. So I know there's a volleyball tournament coming up this weekend at the high school. We'll need to screen. So this includes childcare, sports practices, club gatherings, any competitions. As far as visitor and vendor screenings, we know we're trying to restrict any type of visitors to schools, including vendors. So if someone is there and they're admitted because we need them to come in, daily screening is required using the visitor and vendor screening checklist. Adult guests entering the building should be screened for symptoms, wear face covering, and wash, hand sanitize before entering. Strict records, including date and time, should be kept of non-school employees or other visitors entering and exiting the building to assist with contact tracing if an exposure occurs. Again, required of students, staff, and visitors, vendors each day, offered digitally or paper, not required to show a screen or paper on entry of bus or building. If the answers indicate a possibility of COVID-19 or COVID exposure, the individual is told to contact or to enter the building, is told not to enter the building, and offer Mr. Sanford's contact information. And using Remind, families are going to be reminded weekly to complete the daily screening starting this week. Quarantine rooms, they need to, per the governor's guidelines, be a minimum of 100 square feet. Some schools are going to use a larger space, for example, like a gym. And if they do that, that would accommodate more than one student. And social distancing would be at a minimum of 6 feet. We're aligning protocols across the district. For example, we're almost done finalizing what is going to, the protocol. Once the student enters a quarantine room, here are the procedures you're going to follow. Trained staff supporting students who need to be quarantined. Limit time in quarantine as much as possible. Parent guardians are notified quickly so the student can go home and potentially seek medical care. And then support from local medical and emergency partners if needed.